Good afternoon, everyone. It's good to see each and every one of you. I'm going to have a word of prayer, and then we'll do a welcome, and we'll move forward with what we have for you tonight. Father, we thank you now for your love, kindness, and grace. We thank you for your expertise. We thank you for all of these on the panel that you have blessed with the ability, the knowledge, skills, and the willingness to share one with another. So bless our time together. It is in Jesus' name we pray. Amen. I want to say welcome to this COVID session. Good afternoon to everyone, this COVID panel. It's been a historical day, so I want to thank each and every one for being on tonight. It has been history in the making, and I know there's a lot of things to do, but I do believe what we're doing tonight is ultimately important. We hopefully will see another inauguration, but if we don't get this right, we may not see another inauguration. So what we're doing tonight is ultimately important. We have some of the best medical experts in America with us tonight. I am so proud of them and their accomplishments and their expertise. And I want to say welcome, first of all, to the panel, and then thank them for being willing to share their knowledge, their experience tonight. They have studied hard and they worked hard, and I'm so grateful. So I want you who are in the audience tonight, share with those who may not be on a platform, because it's ultimately important for us to hear what is going on. So hit the share button, depending on the platform in which you're on, and share with those you know and those you love. Now, at this time, we will now have our introduction. Our panel will introduce themselves, and we'll move from there. Okay. So our first panelist is, we'll start with Keisha and work down the program. Okay, let's see, can we unmute her?
All right, good evening. I'm Keisha Bryant. Good evening, I'm Keisha Bryant, and I am a pharmacist, and I am also a part of the health committee here at Orthodox. Good evening.
Thank you, Keisha. And, okay. Let's see, we got to get, I guess everybody can go ahead and unmute, and we should be good to go.
Can you hear me?
Yes, thank you,
Okay.
Rhonda.
Good evening, Orthodox. My name is Rhonda Coney. I am a registered nurse practitioner, and I work in the ICU as an intensivist nurse practitioner at Good Samaritan Medical Center. And I also recently joined an infectious disease specialist up at Palm Beach Gardens Medical Center. And I've been a nurse practitioner for just about 2 years.
Thank you, Rhonda. Marquita.
Hello, good evening. My name is Marquita. I am a registered nurse in the emergency room. Right now I work at Good Samaritan, and I just do travel contracts here in the area. So I work at a couple different hospitals as well.
Thank you, Marquita. We have Venus.
Good evening. My name is Venus. I am a pharmacist, a community pharmacist at Walgreens for 11 years now, and I am a part of our COVID vaccination team here at Walgreens.
Thank you, Venus. And we have also with us Dr. Cheryl Holder.
Hi, good evening.
She could introduce herself.
Yeah, good evening. I'm Dr. Cheryl Holder. I'm an associate professor at the Herbert Wertheim College of Medicine, and interim associate dean of diversity, equity, inclusivity at the College of Medicine.
Thank you all so much. What a wonderful panel. And so first thing up, I will talk about the purpose of the session, and then we will move with some questions and answering. Let me first of all kind of state what the purpose is not. The purpose is not to force you to make a decision. It's not to tell you whether to take the vaccine or not. It is to give you insight what the COVID process really looked like. Many of us either had friends or loved ones who've contracted COVID, and all we know, sometimes they get better at home. We know the quarantine, sometimes they go in the hospital and we don't see them again. Sometimes they go in the hospital, we see them again. But the panelists tonight are people who are on the front line. They have been on there, some of them since March, early March and late February. And so our whole idea is to remove the fear and help you make an informed decision, not based on what happened years and years ago, for instance, like the Tuskegee Airmen, but to hear from our own community of medical experts or professionals, I rather call them. It is strictly informational. And we do need to get the information out. We hear the statistics in places like Jupiter, places like Belgrade, and perhaps my hometown, Fort Pierce, they're probably in the same situation. There's those farm areas. And so we're just trying to get our people informed so you can make an informed decision in the things you do. And that's what we want to share with you tonight. Without any further ado, Keisha will be our facilitator, and we're going to let her do what she does best. She's going to facilitate this panel. And she's been instrumental in other panels we've had with diabetes, and also Marquita, and we welcome you all back again. So I'm putting it in your hands, Keisha.
Okay, thank you. First of all, I want to thank everyone for taking time out of your busy schedule. And I'm sure, like me, you were driving down the highway to get here on time. And, you know, we are a part of the healthcare community. And as the pastor stated, we've been working very hard during this pandemic to make sure, you know, our patients are getting the care that they need. And this is another part of it. Other part is education and also informing patients, you know, what is out there and what, you know, how patients are presenting. So tonight is really about to give you an insight because, as you know, most of the hospitals are not allowing visitors. So we want patients to see the seriousness of this vaccine. So thank you, Pastor, for allowing me the opportunity to facilitate this and share the information with my colleagues. So thank you. And thank you so much, Dr. Holder, for taking time out of your busy schedule to come and to speak with us. She is currently the president of the Florida Medical Association. So she will talk to us
Florida
later.
State.
The Florida State.
Yeah, it's different. Yeah.
Okay. And she will speak to us about, you know, access and availability and, you know, some of the perceptions of the vaccine out there. So we have some pre-prepared questions. And so we'll just start with Rhonda. So Rhonda, how serious is this virus? As a nurse practitioner, what are you seeing in the hospital?
What I'm primarily seeing in the hospital is the effects of contracting COVID. It's primarily an inflammatory condition throughout the body, especially in the lungs. And it's also a thrombotic, meaning it causes clots within the system, and mainly the lungs, and it causes damage to the lung tissue. And as a result, I mean, there's a range. Some patients contract it and they're asymptomatic. So I've seen both extremes, but I usually see them when they are very, very short of breath, very hypoxic, not getting enough oxygen, and to the point where they need to be placed on a ventilator.
Okay, so how are patients really, you know, they're presenting, you just mentioned not having enough oxygen. So is this virus worsening? Are you seeing at Good Samaritan an increase in the number of COVID patients? As a hospital pharmacist at Jupiter, we are seeing an increase in the number of COVID patients coming to the hospital.
Okay. I can say this year compared to last year, I mean, I think this is the second wave. I think the first wave was right now. Our first influx was a lot of elderly patients who are immunocompromised. And now I'm seeing a lot younger population come in. I've seen a lot of African Americans, not just African Americans, immunocompromised people with diabetes, obesity, hypertension, all usually have those three comorbidities, are heavily afflicted by COVID to the point of requiring ICU care, ventilation, paralyzed on the vent so that their body can rest in order to properly oxygenate the cells.
Okay. So just to dispel any myths, a lot of patients want to know that if if I am a minority and I'm actually admitted into the hospital, will I get the same level of care if I don't have insurance, if I am not, rich or wealthy? Are you seeing a disparity in the types of treatments patients are receiving?
No, all patients get the basic treatment. For the inflammation, the patients are placed on steroids. For the clots that happen, the patients are placed on what's called anticoagulants, heparin, Lovenox, things like that. Patients are also placed on antibiotics for imposed infections on top of the COVID virus.
In a little bit there. Where we
Again?
see difficulties is not when they get admitted. It's how early do you go to the emergency room or go seek care. And that's where I see the problems and the little differences in groups. If you have easy access to a doctor, you'll call the doctor early or they'll say you have it, and then they'll check in on you because my patients check in every day or we'll check in every 2 days. If you just get tested and you come for a site and somebody in your family, you may not have anyone to check in with. So that you would come later to the emergency room and then you're more severe. So where the issues are really, it's not when you get the severity of the disease and you're in the ICU, it's before that. So how can we get people to recognize, don't stay home, don't wait too long, especially if you're 65 and older, there's a medication that we use outpatient. A lot of people don't know this because they don't have ready access to doctors and nurses in their systems, in their homes, because they're uninsured or they're far from the hospitals and they're not aware. So the biggest problem that I see is when do you go to get care? And another area I see is when they do go in, when they're sent back home, then they may not want to go back a second time when they get worse because the first time they were sent home. And sometimes they're sent home with monitors. And the monitor we know, especially if you're dark skinned, may not give you the right number. So then they come in again late. So the issue, if you get in the hospital, you're probably going to get great care when you get to the ICU. But the key is how do we get you early before your disease is so severe? How do we get you to come call a doctor, go to the emergency room, come back if they tell you to come back so you're not so severe? Or you can get the outpatient infusion of the monoclonal antibodies at the right time, which will stop you from getting severe. So that's
that. Go ahead. Sorry, Dr. Holder, but that brings up the other question. When should patients present to the ER? Is it the cough? Is it the cough and the fever? Is it the cough, the fever, and the chills? Is it the shortness of breath?
Earlier is better and get checked out, and then they will give you better guidance. We know at age 65, there's a medication that's approved. When President Trump went in, he got that medication. It's approved for 65 and older. So I tell any 65 and older, that drug, you show up, you have a little sniffle and it's COVID, go in, because you can get the infusion and it'll stop you from going to severe. Now, not all hospitals have it, but in South Florida, most of the hospitals have it. And that would help prevent you severe. Or they may start you on the steroids early enough to prevent you from getting severe disease. The goal is to not go into severe disease. And so we really need to evaluate you. If you have a doctor, you could call the doctor, they can monitor you. But if you don't, and you're one of the large number of uninsured people in South Florida, I say go to emergency room, have them check you out, and then go back, because the earlier we can monitor you, the better it is for you. Because when you get to severe disease and end up in the ICU, that's when, all bets are off, especially if you're overweight, if you have diabetes, you have high blood pressure. I don't care what age you are, 30s, 20s, if you have one of those three, show up. Because one of our, not a family, but one of my colleagues, 30 plus year old cousin just died. And she had obesity and all the comorbidities that we talked about. So better to go in, get checked out. Don't stay home. Don't take all the cough syrup. Don't take all the Tylenol waiting to see if you get worse. Have somebody check you out and then they'll follow you.
So this question is from Marquita. Thank you very much, Dr. Holder. And we're talking about, I want to point out what you meant about access and not all hospitals having access to the remdesivir and also the bamlanivimab that, which is the antibody test through the ER. Marquita, are you seeing, what kind of pointers can you give someone when they present to the ER? Are you seeing again a disparity in access? So you say you travel around. So are you seeing that some facilities have it, some don't?
No, I don't see a disparity in the care for the patients that come in. When you come to the emergency room, you give your chief complaint and they basically put you in an acuity of how severe you are, when you come in, and according to that acuity, then you'll get the appropriate treatment. And if you are suspected for COVID, they separate those patients in the emergency room. They don't put the general population, if you come in for a stumped toe or something, or, chest pain, they're not going to put you over with the COVID patients. They separate.
Okay. So what are the precautions like in the hospital setting, Rhonda? What are, just to put those at ease who may have to bring a loved one to the hospital? What are some of the measures that, we are taking in the hospital to ensure that, our professionals are safe and the patients are as well?
Well, our operating room is open, so one visitor is allowed with that patient, and it's mandatory mask wearing throughout the entire hospital for everyone. Visitation just recently opened back, and they allow one visitor per day, exercising the same precautions of wearing a mask. The COVID unit is on a separate, well, not a separate floor, but the COVID floor for the non-ICU on the fourth floor, and it's behind double doors. It's completely sealed off, and it's very limited on who can go in and who can go out. Same as the COVID ICU. And it's mandatory that we wear the N95 mask, goggles, face shield, as well as gowns. So we're very strict with limiting number of exposure to people who don't have COVID, but we also understand how isolating and how patients feel when they can't see their loved ones. And this is a picture of my ICU. And there's 5 nurses, a respiratory therapist, and a physician preparing to what we call prone a patient, turn them on their belly while they're on the ventilator so that they're able to rest and get better oxygenation to their lungs. And so
that's a good point that what are the non-pharmacological things are they doing with patients in the hospitals that present and are tested and candidates for treatment for COVID?
That are being treated for COVID? Mm-hmm. Proning, which is, sleeping on your belly because that allows your lungs to oxygen, remaining hydrated. We encourage patients to get up and move around and not just sit around all day. Sit up in the chair, go for a walk if you're able to. And just pretty much treat the symptoms. If you have a fever, you can take Tylenol. If you have a cough, you can take a cough suppressant or an expectorant. And of course, the isolation from other people who are not COVID positive.
I have a question for the group. What are your thoughts about the vaccine? And a lot of people, we work in these settings, and for most of us, it is mandatory that we take the vaccination in order to work. But what are your thoughts about the vaccine? And certainly we're going to get to the Venus because she's out there vaccinating people. But what are your overall thoughts? And we can begin with you, Dr. Holder, on the vaccination, because there's a belief that there's a mistrust in the African American community about the vaccine, and a lot of people want to wait. So what are your thoughts?
I believe the concerns about the vaccine are real and should be respected, because that is what you should do. When there's anything new, whether it's a vaccine to Tylenol, I do expect my patients and the community to ask questions. Is it safe? And how do you know it's safe? What are the side effects? This is what every patient and physician should do. And we call it informed consent. What are the risks? What are the benefits? What are the alternatives? If you don't do that for whatever reason, you're not being a very good user of the health system, because that's how you stay alive, and that's the way medicine should be. So I respect completely when the patients say, I don't know about this vaccine. That's what we're supposed to say. So now we say, I don't know about this vaccine. So we say, what is it about it? It's new. It is new. But it does come from 20 years, the one that we now have, because there are about 20 more vaccines in the pipeline. The two that we now have come out of new science. When we say new in medicine, it's about 20 years that it's been being evaluated. And it's built on concepts that we've been using for the last 20 years, and we've been able to adapt it to this virus. So it is new. Is it experimental? Yes. But why do we say it's experimental? Because for it not to be experimental, we'd have had to study it for 1 million of people over years, test it out, and come back. That would be great if people were dying, you just heard. So that's why it got experimental use approval. Because when you look at the risks and the benefits and the alternatives, it is worth trying this vaccine, because what we're seeing from the initial studies, the risks were much less than the benefits. And the alternative for about 2% of the people, especially people who are already weakened immune system, you're looking at death. So when you put all these factors together, it is worth a vaccine. Now, we wouldn't need a vaccine if we had a cure, if we had good treatment. When you get, the worst infection, something like a syphilis or a gonorrhea, everybody heard about those. You don't need a vaccine, because you get one shot, you take care of it. We have that for this infection. And this infection is spreading rapidly. And if you're looking at millions of people and you say, oh, well, only about 2% die. If you think about that's hundreds of thousands of people. We've already lost 400,000 people in 1 year. They said the entire World War II lost about 400,000 people. And we did 1 year in this country. It requires emergency action. And that emergency action requires us to say, I am going to take a risk with this vaccine because our preliminary data says it is relatively safe. And we will go from there. I've already taken it, most of my family, but we're all older. And I did not, when I go to work and I have to wear all that stuff all day, and I still am terrified I could get this thing, I feel a whole lot better having some antibody protection. Vaccines I love. I'm a big vaccine person because it works with your immune system. It works with your body developing the things to fight it. And that's the perfect way. That's what we're using now for cancers. That's what we're using for infections. So it's built on good science. Is it experimental? Yes, it is. But there are a whole bunch of stuff that we take. I think half the food we eat, if they studied it, it would probably be considered experimental.
Exactly.
You better preach.
Exactly.
So I say balance it off. Great questions. Be very careful when you take new medications, but the risk for me of getting severe disease and for my family and for a lot of people, definitely is too high and the benefits were great. So I took it. Everyone in our community is going to have to do that. And if you live in an environment that you could get it and pass it on to your grandmother and everybody else in your family, then I think the benefits of getting this extra protection is worth it. Now, if you're rich enough to live in a bubble where you never get exposed, like the guy who owns Twitter, when he shut off President Trump the other day, he was on his private Pacific island out in the middle of somewhere in the Pacific, some Polynesian island that he owned. He will never get coronavirus because he's going to control his environment in his multi-billion-dollar environment. I'm not that fortunate. I don't know if everybody is. So I tell folks, look at your environment, look at your family, look at your health. And if you have any of these, I think the benefits of this vaccine greatly outweighs the risk. Now, younger people, teenagers, 20-year-old, maybe they won't be so big. So I can understand, maybe they say, but if they live with grandma and grandpa and auntie, you're not coming in my house. And I tell all my young relatives that for the last 10 months, you're not coming around me because the risk is just too great. So question doctors, constantly question us. I love it. And question the health systems because it is true. We have been not privileged to the best healthcare as Black people, and the data is clear. I am not saying anything racist. I'm just telling you facts based on what the studies have shown for the last 50 to 100 years. Our care is worse. Now, you may not feel it because it's in the subtle changes of who gets sent home and who gets believed. Who gets the extra, oh, I really care for you, or who just says, sit up, breathe, take your meds. Those are the little areas that you will see the difference. But for the vaccine, I definitely look at your risk, look at the benefits. If the benefits are greater, take it because it starts your body fighting an infection that will kill you.
Okay.
It's that simple.
All right, I want to get to Venus because Venus is at work and she is out there vaccinating the community. So I would like for Venus to talk to us about the different vaccines and the process, of vaccination and what does that look like for those who have not been vaccinated. If you want to take a moment to talk about the two types of vaccines that are out there and why are we getting one vaccine over the other? How are you choosing your vaccines at Walgreens?
Okay, so to answer that question, that was actually determined by the state. They determined who's getting what vaccine. So Walgreens, we were allocated the Pfizer vaccine just because it was the first available, and we were pinned to do the long-term care facilities, which were phase 1A. So we had to pretty much take what was available at that time, and this was mid-December that we started vaccinating these facilities. So the alternative one is the Moderna. As far as differences, they're very similar vaccines. The main thing that's different is the logistics and the storage of the vaccine. So is one better than the other? No. It's kind of like two different brand names of a medication. You can't say one is better than the other. The efficacy is the same for each of them. They both teeter between 94 and 95% as new data comes out. It's just the storage requirements are a lot more favorable for the Moderna, which is why that one is going to be more readily available for the community because anyone can refrigerate it, basically. It doesn't have to be on the ultra cold storage like the Pfizer vaccine. What was another question? So far, what it will look like for the community to get vaccinated, how we're anticipating rolling it out, you will have to do everything online first. And this is a CDC requirement. So everyone will need to help those family members that may not have access to computers or internet or know how to work appointment scheduling. And this is a CDC requirement. Everyone has to submit in a portal their information to determine eligibility. Once you put in some basic demographic information, it will schedule you an appointment. The appointment most likely will be 72 hours out from that initial input into the portal. And then you'll have your appointment to go into either the Walgreens. Publix right now is doing it for 65 and older. And you will go in and get your vaccination. And if you're getting the Moderna, 28 days later, you'll be coming back to that same facility to receive the second dose, and 21 days if you get the Pfizer vaccination. I know that also was a concern. Everyone was asking about the second dose. What if we run out? Will it be available? As of now, there is a 4-day window. So you have 4 days either way to get your second dose. So, you know, there is a range in the event that this happens. However, for Walgreens, I can say that we're allocating the doses by what we have. So if we have 100 doses, for example, we're saying we only have 50 shots, 50 appointments available. We are taking into account that second dose. I don't know if any other facilities are doing that, but we're definitely ensuring that everyone has that second dose available to them.
Good, Sam did the same.
Okay. There is, people have been asking about the Johnson & Johnson vaccine that's getting approved now. It is a 1-dose vaccine. The only thing about that one is it's only 70% effective as of now. So the efficacy is not as great. However, I don't say that to knock that vaccine, because if it comes down to that being the only vaccine available to you, I strongly advise you get it. Obviously, the 2-dose series is going to give you more protection, but something's better than nothing, considering where we are with this right now. And logistically, that one actually may be better for some people. Some people may not be able to come back to get a second dose for whatever their reasoning is. So I'm definitely not knocking the Johnson & Johnson vaccines, but I just want to let people know it does have a lower efficacy, and it is 1 dose.
So Venus, I'm sure you've seen the news about, you know, now I think the Publix portal was full after about 30 minutes. Are you experiencing those same delays with Walgreens, or do you guys have enough vaccinations to get out to the community?
I believe Walgreens is taking that same approach. I'm sorry, Publix is taking the same approach. If they only had X amount, they only put that many appointments. Walgreens, we have not opened up our community portal yet, just because we haven't fulfilled our requirement with the long-term care facilities yet. So I hope that's not the case, being that we do have more locations available than Publix. And we are anticipating to receive more doses than Publix, just because of our contractual agreements. So I'm hoping that's not the case, but I just don't want people to be discouraged. You still will have a chance. So keep trying.
The supplies are limited now. And so everyone, the reality, everyone has to get up early and be the first online. My sister got up at 5. The Publix in Brevard County made the notice. They sent a tweet. Now, this is the problem. They're going to tweet out when they're available. And so she called in at 5, started at 5:30 on the line. By 6 something, she got a spot. Probably by 7 it was closed. And that's going to be until the supplies are sufficient. So if you're not, everybody should be on the county's Twitter account and everyone's account. You're going to have to get systems to help the elderly. Is the best way? Obviously not. But until something changes, everyone will have to figure out how they can help the older people get on the, because it's first come, first serve. And it definitely benefits folks who are more computer savvy, who are more educated, and who have more resources. And that's another basic fact. So when you see the data on who's getting immunized, you will see a smaller percentage of Blacks being immunized. First of all, we don't make it past 65, so the percentage of Blacks that are over 65 in your population is not as high. And then even the ones who are over 65 do not have the digital divide is real, do not have the access. So you're going to have difficulties. But
Dr. Holder, how is the Florida State Medical Association addressing the accessibility?
Well, we have,
communities?
Florida State Medical Association are the Black physicians in Florida. And we, as everybody knows, there are not many Black physicians in the entire nation. You're looking at under 50,000 for the entire country of over 1 million doctors and 300 million people. So our voices, we are partnering with other people to get the word out. So you've seen, we've had a task force since the beginning of the pandemic to work with the state. We've met with Rifki's, we've met with Shamil Robertson, we met with the emergency management person to let them understand some of these inequities, the distribution issues. We were one of the groups that helped start up the walk-in and the parks and times. And so they're aware of what's required, and we keep the pressure on. So we do it through interviews statewide. We're on the phone, we're on with our commissioners, we talk with our representatives. So I think everyone is very versed on the structural issues and the barriers for poor people to getting this vaccine. So I don't know anyone who hasn't done the message, and you hear it all over. Everyone is screaming about the digital divide. Everyone's screaming about the unfairness of just opening it like this and not securing doses for the highest risk populations when Blacks are dying at 3 times the rate, yet you're on a first come, first serve basis. Forget about vaccine hesitancy. There are enough of us who wants this vaccine. So just the elderly I know want the vaccine and still can't get access to it. So what we're doing as individual physicians and as a group, working with the legislators and working with our commissioners and writing and calling folks and getting the word out, and also trying to mobilize with the churches to use the churches as a possible avenue to get the vaccines, even if we don't get the vaccines, but collecting the names. So there are several churches that are collecting the names of the eligible parishioners and trying to funnel them into the sites. So it's a big grassroots effort to get these folks who want to be vaccinated. And when the supply gets better, it'll be even easier. But for now, the supply is an issue.
And also, speaking of accessibility, hopefully assisting those churches and community centers in organizing getting the vaccine out. Once the people come to those community centers, I was there this weekend with my mom, and the parking was poor, and the elderly had to walk like a quarter of a mile to get to the community center. And then they had to wait outside like an hour and a half. So hopefully, they will put other healthcare professionals, at the table right there, in those communities, so they could better understand the logistics once we do get our elderly out there. And I just often wonder how we're going to, approach the sick and the shut-in, because there are people who are not in long-term care facilities because they don't qualify for that, but they are at home.
Dade County recently started contacting many of the homes, and they're going to send the fire, the paramedics. They will be going to the homes. So some of that is starting to be addressed. I was on a call yesterday with the new Florida legislators and the Dade County Medical Association. And this issue is not simply with the Black community, also the Hispanic communities, all the communities are experiencing the same problem. So the Dade County, which is the American Medical Association, so those are the white doctors, are the non-Black doctors. Now we've joined together in many ways. We've kept our separate institutions, but the American Medical Association didn't allow Black physicians to join until about 1960s. So that's why there are 2 organizations since 1895. But we work together, and the Dade County Medical Association brought the same issues up with the legislator, and talking that you can use clinics like Sanitas, Leon. There's so many clinics with staffing. The federally qualified health centers I've also started, but there are many clinics and providers that we could be central in immunizing our communities if they develop a system to get it to us. So that's going to be the push in the next month.
So what I think what we're saying collectively as a group is that to still be patient. You know, we're actually late coming out of the gate. You know, previous leadership kind of, you know, pretty much said that this thing was a myth, and so we're late getting to this fight. But we're saying to every patient out there, every person, please hold on and also get vaccinated, because we need to eradicate this vaccine and this disease. And we also are saying that there is a digital divide and that we need to help our elderly aunts, uncles. We need to help them get on those portals, get signed up, and get them to get vaccinated. So we do have a few questions. This one is for Dr. Holder. They said, what is the medication that you said is used for 65 years and older?
Outpatient monoclonal antibodies. It's an infusion, and it's the same thing your body would produce, but this is a chemical version that gets your body to fight the infection. And it's been shown to help prevent the disease from going from mild to moderate, from it going to severe, because it starts to fight the infection with the infusion of the medication. But it's an outpatient treatment, and it's early in the infection and will help you not to get worse. So that's why you have to get in early for them to evaluate you.
Is that also called Regeneron? Is that the same?
Yeah, that's the company that makes it. There are two companies that make it.
Yes.
This
Marquita, this is a question for you. It says, should you test for COVID-19 if you have no symptoms?
If you have been exposed to it, they suggest that you do get tested. And if you don't want to get tested, then they suggest that you do quarantine yourself if you've been exposed to it. But you can definitely feel free to get tested if you think you've been exposed to it, you know, just to be safe, especially if you're around the elderly, like y'all said.
Okay.
Yeah, we tell everyone get tested at some point. If you're gone to church, you're in a community area, you're close to someone, you spent more than 15 minutes in a close to, and they weren't wearing their masks properly, you don't know. So you might as well, there are free sites all over, so you can know for sure.
And Venus, I think there's a question here for you. It said you mentioned that Publix is vaccinating the 65 and older, but they did ask the question, is that the same requirement for Walgreens? But I think you said that Walgreens has not opened up vaccinations to the community.
Correct. Yeah, we have not yet. We do, obviously, when we do roll it out, there's the first group that we will allow would be 65 and older. However, you know, they're still evaluating that. Like, are we just going to go straight for the general public, anyone who wants to get the vaccine? It just depends what phase we are in terms of vaccine distribution, because the general public's phase 2 and 65 and over are still phase 1C. So if we're still in that phase, we have to abide by those regulations.
Okay, and I think this question is for anyone. Can an individual be asymptomatic longer than the incubation period of contracting the virus?
Once you're asymptomatic, you really don't know that you are. So it's only if you were randomly tested and then we found it. And then we would put you in quarantine for at least 14 days, 10 to 14 days and see. But if you're not symptomatic, I don't know, incubation period, it's hard to say because you don't feel anything. You're thinking of what we call the pre-symptomatic. There's that period of a few days where you're infected and you don't have symptoms, and then you become symptomatic. Though that medically we call that the pre-symptom, they're asymptomatic, we call that pre-symptomatic till they become symptomatic. If you're fully asymptomatic, you've had the infection, you cure it, and you didn't know.
Also, here's a question. If you take the vaccination at one location, can you register at a closer, separate location for the second?
I can answer that.
No.
The answer is no, just because the allocation, like we spoke of, is you're allocated to that pharmacy, that whatever clinic you receive the vaccine at. And if they're allocating it appropriately, they have your second dose on reserve. And I know the way that Publix and the way Walgreens will do it is, if you have an appointment, let's say Friday at 11 a.m., 21 days, your appointment will be at 11 a.m. if it's a Friday. So they're trying to even keep your appointment time and everything as uniform as possible to mitigate just the confusion and to keep everything streamlined and to, again, keep your second dose on reserve.
If we had a great computer system software and everybody was tracked, that would work, but that would be very difficult to keep in our current system to know where your second dose is. But probably in another year or so, who knows? But can I say one thing? Until you're immunized, we do have a very effective way of preventing infection. And that is wearing your mask, standing 6 feet away, washing your hands. And you do that, that also is very effective of preventing infections. So we don't want you to take risks until you get the vaccine, because even after the vaccine, you're going to have to continue wearing your mask. So please do the inexpensive vaccine method right now, because every time this virus gets into somebody and replicates, you increase the chance of that virus mutating and getting another worse strain. The goal is to not get infected at all, whether it's through vaccination or wearing the mask. We've got to stop the transmission and stop the infection, because every time it infects somebody and replicates 10 times more, we're going to get a super variant. So wear your mask, stand back, wash your hands. Assume everybody's infected and stay away till we can get this thing under control.
Okay, another question, because again, a lot of the questions are about accessibility. So if someone received the first shot, but they're unable to get the second shot, are they going to be okay?
Okay.
You want to answer?
No, go ahead. I mean,
So ideally, you will get the second shot at some point. So maybe the question is more along the lines, if you can't get it in
beyond
that.
The point, beyond
Correct.
the 21 days, 28 days.
So the current advice is to get vaccinated for your second dose as soon as you're able to. You do not have to restart the 2-dose series, and it at this time does not change the efficacy.
Now, what will happen is you don't have the antibody level to really, we think, protect you sufficiently. So it's not that you're not okay. It's just that you don't have the ability to fight off the virus if you get infected. So that's why you need the 2 doses to get your body to the level that it can fight off the infection. Remember, the vaccine right now, we don't have proof that it prevents you from getting infection. What it does is that if you get infected, you don't get deathly ill. So if you don't come back for your second vaccine, you're not going to be as super protected. You may have a little bit, so maybe you don't get deathly ill in the ICU for 2 weeks to a month. Maybe you just get really sick for not in the ICU. But what we didn't mention is that after a lot of people recover, even if they're not in the ICU, they don't feel well. And I have patients now who are this, I just saw her patient on Tuesday. She's 8 months out and she still can't work fully because she's tired and she still has brain fog. And she didn't even end up in the ICU. So it's just not an infection that you need to get. So that's why go back for your second dose.
So there are some reports on the news and some blogging about some of the side effects with the vaccine. And as we know, almost any medication, there's not a medication out there that, there's 0 side effects. So what are some of the side effects that patients are, and this is for Rhonda, Marquita, Dr. Holder, and Venus, what are some of the side effects that you've had patients complain of if they have received the vaccine? We could start with Rhonda.
Sure. When I had my first shot, I had some localized tenderness at the injection site. Some of my coworkers had mild flu-like symptoms, fever, chills, even headaches. Another coworker who unfortunately did have COVID, she mounted some serious reactions only because she'd had it before, is my understanding. And so she was really, really sick, but it was only for a couple days, opposed to being out from work for 4 or 5 months when she first caught the actual virus. And she's back to work. So, and then we take precautions at Good Sam after the employees are vaccinated. They have to remain in an area for 15 to 30 minutes to be monitored for an allergic, to be monitored for an allergic reaction.
Marquita, are you seeing patients complaining of the same symptoms after receiving the vaccination?
Yes, I had a couple of coworkers that received the vaccine, and they complained of similar symptoms of what Rhonda was just saying, the soreness in the arm for a couple of days. A physician had, he said he felt like he had the flu. He felt really tired. And he actually did, he said he vomited a couple of times, but after that, he said that he felt better, and he felt back to his normal self. And that was just initially, like a day or two after he had got the vaccine.
Yeah, that's very common, and that's what the data shows. Most people have vaccine site soreness, tenderness. The better your immune system, the more you kind of feel a little bit worse. So these are good signs. I felt nothing much after the first one. The second one is a little bit more because your body is already primed. So I say those are great signs that your immune system is functioning. So the worst, I have not seen any of the terrible ones that I read about. And so we've been very fortunate in our experiences so far. But this is what happens when you take a new medication and you send it out over millions. We will start collecting the data and see some of the effects. But what we're experiencing now is what we've seen with the flu vaccine and all the other vaccines. So it's not too bad.
Go ahead.
Yeah,
Dina.
just to piggyback on that, if you're experiencing those reactions like the fatigue, the mild fever, a headache, it's actually a good thing. Your body's doing exactly what it's supposed to do. It's revving up, it's getting ready to fight the great fight. So it's literally doing what it's supposed to do, and that's a good sign. But none of them are debilitating. None of them should stop you from being able to go to work or, your normal daily functioning. And it's transient. It's very temporary. It doesn't last for long. You can take Tylenol or Advil to treat either of those symptoms. So it's definitely a good thing. It's a good thing if you're experiencing that, your body's just reacting the way it's supposed to. We've done a facility where I've administered up to 1,000 shots in 1 8-hour block, and no one had a severe reaction, thankfully. So that made me feel good, and I felt comfortable taking the vaccine. I'm like, okay, I've done 1,000 people. No one's on the floor. All right, I'm ready.
Okay, well, that did answer a question from the audience. Would the second dose affect you more negatively than the first? And I think we did say you could experience some symptoms that may appear to you to be worse, but that's actually a good thing. So thank you for answering that.
Also report it back. If you do feel something even more, report it, because like we said, this is new. It's still in the experimental phase, but we collect the data. Because when you're going to immunize 300 million Americans, we do expect a certain percentage to have some side effects of something. And this is what we need to collect. So if you feel something, report it. There's a vsafe.cdc.gov that you can send the information to, or you can let the site know where you were, because this is important that we know what to expect and what percentage of the people do it. It doesn't mean you're afraid of it, but it does mean that we collect the data, because it's really good to know how great the vaccine is and what are some of the problems.
Yeah, we're informing the future when we do that. Absolutely. And that's what this is all about. So one other question, and we really have 5 more minutes, and I just really want to thank you guys. This has been very informative for us, for me, sitting here listening to the various areas of expertise that we bring to the table. So thank you for that, and I'm sure our audience is way more informed than they were before. One last question was, has there been any discussions, plans to deal with PTSD for the medical community?
In medicine, we have since I'm in medical school, the Association of American Medical Colleges have created a whole system in place to talk about these issues with the residents, with the professors, and reaching out and letting people know that, we're here. Don't be afraid, especially after the suicide of the doctor in New York, the emergency medicine physician. It is very much part of coping better with this very difficult situation of death and dying. And so one of the things I went through HIV/AIDS. I'm old enough before you guys were around. So it's like hashtag not my first pandemic, which is unfortunate. But the response now for the physicians and the providers is way 10 times better than what we experienced back in the 80s and 90s. So we are, and I don't know if your nursing agencies, the SEIU, all the facilities, all the people I work with are much more attuned to the effects. And we ask people to reach out to us, and don't be afraid to express your concerns, and knowing that it's not a negative issue. So in that way, we are much more aware of it in the medical side. I don't know about pharmacy and the nursing side.
And I guess my question is, do they mean like stress disorders or the post-traumatic stress disorder for us as healthcare practitioners, or for the patients? So,
Well, I was thinking for us as healthcare practitioners, because this is not easy.
Yeah, it's not. And it's been a very long time, and it doesn't appear that we're going to have a break in this for months to come. For Jupiter Medical Center, the operation, where I am the pharmacy operations manager, we've started morning meditations. They've put together break rooms. We can do yoga after work. I mean, so they're really trying to. We have a spirit cart that comes around just in the middle of the day, just bringing goodies for us to eat and kind of have a break in your day. And they encourage us to take a walk. But I do appreciate that question. Thank you very much for thinking of all of us during this time. Because we all, self-care for us is just as important as us caring for others. So I appreciate that question from the audience. If there are any more questions, please share those in our chat. If not, if anyone wants to leave, we have to not leave, but leave the audience with some encouraging words. And we could start with Rhonda. Any last minute thing that you wanted to say and you may not have had a chance to say, and we want to do that quickly. So Pastor Chester could close us out.
Well, I just think it's important because patients are so isolated and are not able to have visitors, that we take advantage of platforms like this where we can Zoom or FaceTime, because we do use iPads in our ICU so that patients, family members can at least see their loved ones. So I think we can try to increase opportunities for patients to connect with family members, as well as nurses to connect with each other and offer support.
Marquita, do you have anything?
Just thank you for the opportunity to speak and to help these people. And I just want to say, if you have any questions or concerns, or if you think you have been exposed or you have any symptoms, don't be afraid to go to your nearest emergency room, because the healthcare providers are there to help you. And yeah, that's it.
Dr. Holder?
I just say always ask these questions. Don't be afraid of saying that you're concerned about the vaccines. But when you do ask with an open mind and listen to the risks and the benefits and do the analysis. Many times, oh, I don't want this because I've heard so-and-so. It's find out what are your real concerns. Don't go with anybody else's ideas. Listen to the science, listen to the risks and the benefits, and then say, by doing this, will I be protecting myself, protecting my family, and protecting my community? Because we must all do this together to be able to get back to a new normal where we have better lives. But we can't do it individually. It has to be done together. So really ask the questions and do it with an open mind.
Okay, Venus.
I just definitely do your own research. Don't rely on social media solely for your information. There's a lot of information direct from the manufacturers, from the CDC. So if you have vaccine hesitancy, just look it up, see what things are concerning you, to see if there's any information to help you feel more at ease or comfortable. Speak to your pharmacist. I'm available if anybody has more detailed questions they need answered to that we weren't able to get to today. And just please have patience. Everyone who wants the vaccine, you will have access to it.
Okay. All right, Pastor, we're right at 8:02, so.
Thank you, thank you, thank you. I'm so encouraged. Matter of fact, Venus, I'll be down in about 15 minutes to get my vaccine, and so you're still at work. But I really am impressed. I'm really informed, and I think we have a unified message. You need to make an individual decision. As Dr. Holder said, I wrote down the list of things that I would mean why I should take it, with the comorbidities and all of the other things that I've been faced with, recent radiation. And it was only one reason. I had about 7 reasons why I should take it. My wife worked at a daycare. My grandson works at Publix cleaning carts. And I only came up with one reason not to take it, and that was because it's going to sting a little bit, and I can get over that. So it has been good. I do want to say individually, thanks to each and every one of y'all, Rhonda, Makita, Venus, Dr. Holder. Thank you, Keisha, for being our facilitator, putting this all together. It has been wonderful. Just want to say a couple of things in closing. On our website, ozpbc.org, we will have the link to a YouTube, and it's called the COVID-19 Vaccine, What You Need to Know About Infectious Disease, by specialist Dr. Osami. He was unable to be on tonight, but we do have that so you could look at it. And I also want to mention one of our own members, Brother Stanley Wood, was a part of the Moderna study. I just found that out Sunday. And he did get the real thing because he took his blood test this week and he has the antibodies in his blood. So all of those things are the things that help us not to make decisions on something happened years ago, something you heard, but we've heard from some of the best in South Florida and in America tonight. I thank you so much for sharing your experience with us, and God bless you. I leave you with this, and I'll close with a prayer. If you could ask the 400,000 COVID casualties tonight, if the vaccine was available, would you take it? And I believe we know the answer they would say. And with that, God bless you. I love you. I'll close with prayer. Father, we thank you now for everyone. We ask your blessing as we go forward. But most of all, Father, we thank you for the protection you've given these frontline workers. And we solicit you to continue to let them do and let them know it is a ministry as they minister to people. Bless us individually and collectively is our prayer. In Jesus' name we pray. Amen. God bless you. Thank you, thank you, thank you. Love you all. And the Lord bless and be upon you.